female or male fetus. Okay. Prediction of gestational age by ultrasound is more accurate when it's performed before 24 weeks of gestation. Why? Because the baby is not tight, it's moved easily, and it's because sometimes if the head is in the pelvic area, it's hard to measure the head. So better at that time. Gestational age cannot be predicted accurately after 28 because that reason. Of course, the most accurate measurement is the crown round length, but that is first trimester. The first day of the last menstrual period is the standard way to date a pregnancy in the United States. And you have to be very precise with the question you ask to the patient is the first day. That is important because if you ask what was your last menstrual period, she can answer whatever she wants. The first one or the last one, so first day of the last period. Duration of the pregnancy, 280 days, 40 weeks, 9 months, or 10 lunar months. Okay? Everything is the same. Eh?
Okay, they said 10 lunar months.
Because, my dear, the rotation of the earth, of the moon, during 9 months, the rotation of the moon rotates 10 times. Okay? That's the way. Okay, that is the growing of the uterus according to the gestational age. Usually, and that is the day for you, 20 weeks have to be at the level of the umbilical. When you put your hand and you feel the fundus of the uterus, at the level of the umbilical is around 20 weeks of gestation.
But it's so weird because a lot of pregnant women, like, their belly grows at different times. There's a woman that's 6 months.
No, but if you touch, the belly knows what the patient looks. It's when you touch and looking for the fundus of the uterus, you will see that it's at the level of the umbilical around 22 weeks. The trimester, we have 3. The first one from week 1 to 12. Second one, 13 to 26. And the third one from 27 to 42. Even the pregnancy is considered to be actually at 38 weeks. But you have that 38 is fine, 39, 40, 41, and 42. Post-term pregnancy, more than 42. And preterm pregnancy, less than 38. What is the, no sé cómo se dice eso, Naegele's rule is the way is the estimate delivery of confinement or due date is calculated. That's the way the machine calculates that. That's the way the little rhombic too.
The circle, yeah.
That's the way everything is calculated. So, and it's that way.
Do we have to memorize it? Or?
Yes,
Okay.
you have to know that. The last menstrual period, you subtract 3 months and add 7 days. That is the estimate delivery of confinement. If you have the estimate delivery, because sometimes, most of the time, when you ask a pregnant patient when was your last menstrual period and she is in the 20-something weeks, she doesn't remember, but she knows when she's going to be ready. So you calculate then the last menstrual period, knowing the estimate delivery of confinement or due date, add 3 months and subtract 7 days. Capisci?
Mm-hmm.
Okay. Por ejemplo, last menstrual period, October 17. So, less 3 months is 7 months. Okay? July 17, and you add 7 days, would be July 24. Got it?
Mm-hmm.
So right there you calculated the EDC.
Yeah. Because you know the last menstrual period. If you know this, then you calculate the last menstrual period. What is that? Gravity and parity. Gravity is how many times
You got pregnant.
the patient has been pregnant. Sometimes the patients only count the baby that she has. So you have to ask how many times you get pregnant, including abortion, miscarriage, any bad outcome of the pregnancy, anything. That is gravity or gravidity. And parity, all possible pregnancy outcomes. Okay? So I have 5 kids, one was C-section, the other one is a twins, and the other one was a premature. That's parity.
So that's live birth, the one that she gave.
Mhm.
Yeah. So when you see a report, you see G7, for example, 7 pregnancy, and P, and then 4 numbers. That means the first number means the full-term delivery. The second number means premature or stillborn. Third number, early pregnancy loss, so miscarriage. And the last number, living children. For example, this.
Mhm.
That means that this patient has been pregnant
4
4 times.
Yeah.
Including the present one, okay? That is included because we're talking about pregnant patients, okay? So, she has been pregnant, including that one, 4 times. So, 4 pregnancy, 2 full terms,
Which means?
one
premature.
No abortions, living child at
Three.
this moment,
3.
3. If you add 3 plus that one that she has in that moment, that's why it's not count right here. Capichi?
Mhm.
Okay? I'm going to show you my personal history. Okay, I add like this. Let me see and see what was it.
Mira, lo está cambiando.
Okay, suppose that I'm pregnant right now, no?
One. No, triplets.
Okay. Si no estuviese embarazada sería G0.
Yeah, but you are talking about
A pregnant woman.
So,
Verdad.
I have
4 total.
one.
So you've been pregnant 4 times.
Yeah, including that one.
Okay.
Including it.
One.
I have one baby, full term,
4 term.
Which means what is
0 premature.
que nació a las 38, 40 semanas.
Oh, okay,
That's
that
full
you,
term.
okay, so
Okay.
9 months.
No,
No premature.
No premature.
2 abortions,
2 abortions and 1 living.
and 1 living.
Entonces,
She's my daughter, and that one.
so that the
That
last
means
one
that
is
3
gonna
of
be
your
the
babies
first
died.
2.
No.
No.
Because you said you only have 1 living.
Yeah? 2 died.
2 died.
Because of an abortion. Okay? 1 living now,
And
and,
one
the
you-
one that I carry now.
Oh, okay.
The pastelito guayaba that I carry now. Got it? Okay.
So then the last number is always gonna be the first 2 numbers after P put together.
Exactly. Bueno, only
Now, sometimes.
remember the second number is premature or stillborn.
Born.
So in that case, it's not in the last number.
Mm.
Bueno,
But that is
yeah,
something
because
that you
you're
have
adding
to
0.
document. But if you don't document anything, we assume that it's for premature. Got it? Okay. So, fetal position, of course, changes. That is one of the most difficult things to determine. So I'm not going to
I see now
go
3.
too much deep in this because that is very confusing. Change length, of course, after 34 weeks. To determine fetal position, it requires information regarding which maternal plane you are and fetal plane section. No se me machaquen.
No.
3 basic positions. Right, this, oblique, that is the maternal plane, okay? Transverse, oblique, or longitudinal. This vector demonstrates the 3 major possible axes that a fetus may occupy. Okay. fetal light does not necessarily indicate whether the vertex of the bridge, because the baby can be like this, but head up and feet down, so, okay.
Filling.
Face up and down.
Tenemos transverse, that could be with the head here or the head here, it depends, okay? And then you have
Cephalic and breech.
this. You have the cephalic, which is with the head first, but could be vertex, which is the ideal position, okay, which is like this,
Mm-hmm.
that you see this, because could be head and could be like this, and you see the face
Face.
first, or you see the occipital bone
So that's
first.
at the
That
face.
is complicated.
The face is
Mhm.
here then.
Eh?
The face is near the cervix. It's like right there.
So like this, so ready to come out.
Está
Yeah.
en
Yeah, yeah.
posición.
It's in position.
Yeah, but you have vertex, which is a
Pero hay diferentes
95%,
cefalos.
exactly.
Yeah.
That's crazy.
Since he put brown on face,
You
it
need to know
depends.
that, right?
Yeah.
No, I'm asking her.
No, yeah.
You need to know that?
I think that this means cephalic,
And
Breech.
breech, yeah.
and shoulder.
Yeah, but the individual one.
Oh,
Okay.
oh no. No,
The
man.
breech is with a foot first, okay, that could be foot lean, front, and complete. And shoulder is that one needs
Eso sí huele.
Eso se sabe, right?
Of
Yeah.
course. Yeah.
No.
por lo menos aquí. En Cuba te hacen
Debe tener
palitos.
un dolor en el cuello.
Okay, so that is the ideal position, vertex of cephalic, perfectly, okay. Yeah.
En el boy, yeah.
In the fundus. Okay, that one, for example, that is a cephalic presentation. Okay, and the cervix is right here, más o menos. That one is
Breech.
that is the
Complete.
front bridge. That
Uh-huh.
is with the butt first. ¿Ves? That
Complete.
is called
Complete, no?
No, it's called frank
Frank.
bridge.
Que se parece un Buda.
Yeah, that one.
Mm-hmm.
Right, complete bridge, incomplete, and frank con la nada. Ok, te das cuenta. Ok, más o menos. No big deal with this thing.
Breach.
Este sí está cabrón.
So that means,
That's
so
good.
means this one was what?
That one is the cervix is here. If the cervix is here.
The
for-
foot is by the cervix.
That one is bridge. ¿Cómo se llama? Okay, what about this? Situs mean in Latin in place, okay? In situs is in place. In addition to determine fetal life, the right and left side of the fetus should be determined to ensure normal situs of the fetal organs. So the stomach has to be on the left, the apex of the
Heart.
heart has to be on the left. The descending aorta has to be on the left, okay? The liver on the right, the gallbladder on the right. That's the main marker that you use
Everything in place.
to know the fetal situs. A
Stomach.
sonographer may differentiate the right from the left, identifying the stomach, the gallbladder, the apex of the heart, and the fetal aorta to the left of the midline. Cranium is complicated.
Yeah, ya lo leí.
Yes, solo sé my therapist.
The embryonic head can be identified by ultrasound by 7 weeks. The principal structure seen within the first trimester is the coroplexus that are completely filling out the lateral ventricle. So, at the beginning, well, you know that the coroplexus occupy most of the brain, okay, of the cranium. Like this.
Like that's the one that prevent the fluid.
Eh?
The cerebral vertebral spinal fluid.
Yeah, the coroplexus that's the. Okay, that is a picture that is obviously because that picture of the head that is in the first trimester because the coroplexus is huge.
Mm-hmm.
Okay, the coroplexus is they're responsible for the production of the cerebral spinal fluid. Right? That is first week.
Mm-hmm.
Okay. Transfer view of the fetal intracranial anatomy taken at the midsection of the fetal head. Okay, the structure that we have to see in order to know that you are in the correct plane to do BPD and head
Transverse?
circumference is the thalamus. Okay, we have two thalamus, one in each side. The problem is when you scan, you look like only one structure, like in front of a heart, like in a shape of a heart. Okay, that's the thalamus. The other thing that you have to see is the falx cerebri, which is the division of the two cerebral hemispheres. Okay.
Where is that word Miss, that you just said?
El falx.
Yeah.
Ahí está abajo.
It is all this.
Yeah, pero
La palabra
el
está abajo.
false. Oh, okay.
Okay. And anteriorly, you will see the cavum septum pellucidum, which is two echogenic lines that is part of the lateral ventricle. Okay, that's the main thing you have to see. The cerebrospinal fluid circulates through the ventricular system, around the brain and around the spine, because we have cerebrospinal fluid not only in the head, in the spine too. Well, in fact, when you have to, they do the lumbar function, they get a sample of the spinal fluid. It is absorbed by a specific area of arachnoid, one of the three meninges, the membrane that covers the brain and the spinal cord. It is between the two other meninges, the more superficial dura mater and deeper pia mater. Okay. The brain is covered by three meninges. Okay? And the spine as well. We have the pia mater, the dura mater, and se me olvidó la otra. Arachnoid, the space in between. Excess production or failure of absorption produce hydrocephalus. Okay, because has to be a balance. Production of cerebrospinal fluid by the coral plexus and the arachnoid, which has some vessels that reabsorb that fluid. Okay, so that's the one to keep the balance between what is produced and what is absorbed.
That's a really bad disease because the baby has no coordination, she has to have even brain surgery and everything.
Okay, hydrocephalus is a pathological increase in size of the ventricle and the head circumference. Ventriculomegaly describes the increasing size of the ventricle above the normal range for gestation. Oh, you can have ventriculomegaly without hydrocephalus. Okay? So you can have ventriculomegaly and the head shape is normal and size. Of course, you can have a lot of ventriculomegaly, and in this place, in that case, you have hydrocephalus. That is more or less okay. That is the ventricles and the coral plexus. Okay, and that is the way this fluid goes down to the posterior fossa and then to the spine. The sonographer must be expert at recognizing the normal appearance and developmental change of the fetal brain. Brain tissue looks hypoechoic. By 12 weeks gestational age, the cranial bones ossify. By 18 weeks, the texture of each brain structure has been determined. That's why the target ultrasound, the best ultrasound, is done between 18 and 20 weeks.
That's the whole anatomy when you do the...
Yeah.
Okay.
The water content of fetal brain is high, contributing to the cystic appearance of various brain structures. As the brain develops, the structure changes the sonographic appearance. Like I told you, the coral plexus at the beginning looks huge. However, when the head starts growing, the structure relationship between head size and coral plexus is when you can see that the coral plexus looks smaller. Okay? Okay, that is the lateral ventricle, and that is the choroid plexus inside. Okay? Okay, again, choroid plexus and early gestation. Alright, where are you going? And that is the choroid plexus later. Only un pedacito, a little piece. This is the
Talones, ¿no?
cavum septum pellucidum,
En medio.
these two echogenic line. That means the face of this baby is right here, and the back is right here. And that line is the fox.
Ox.
Okay. Okay, first thing, check the contour of the school bones. We do that, again, unconsciously, so you know if something is wrong with the contour of the baby head, you will notice immediately. The cranial appears as a circle at the highest level and oval at the ventricular level. That's why when you have to do the measurement, the measurement has to be not like this, because the head looks too round. Has to be like this.
Oval.
Okay? And from the same point, angulate a little more down, and you will see the cerebellum.
Como like oblique, now,
Okay?
man?
Yeah.
Okay.
So the cranial appears as a circle at the highest level. That's why it's not a good image to measure. Come on, what happened? The outline of the cranium should be visible. If it's not cranial absent, to be considered. The next step is to assess the development of the brain. Alright. Ventricular system, super important. The ventricular system is a set of structures in the brain that communicate one to the other and end in the spinal canal. There are 4 cerebral ventricles. Okay, 2 lateral, 1 and 2. The third ventricle in the middle and deep. The fourth ventricle more posterior, close to the cerebellum. Okay, and then the cervical canal.
So 2 lateral. 1 anterior.
1, 2, 3, and 4.
Oh, okay. 1, 2, 3, and 4.
Mhm. The ventricular system contains cerebrospinal fluid, which coats the brain and spinal cord. Cerebrospinal fluid is produced by the choroid plexus within the lateral ventricle. This tissue is echogenic and very prominent in early pregnancy. From the lateral ventricle goes to the first ventricle through this little hole or canal, which is called foramen osmorum. Okay? So from the 2 laterals
Goes there.
through the foramen osmorum to the third ventricle. And from the third ventricle to the aqueductus ocilium to the fourth ventricle. So from the third ventricle, the fluid travels to the fourth ventricle through the aqueductus ocilium. When the fluid reaches the fourth ventricle, it flows into the supraarachnoid space, okay, and it's redistributed. Distribute in the brain and
The spine.
the spinal cord. Okay? So, si venimos hoy. Coño, no dejé lugar para escribir. Okay. Second. Lateral ventricle. Okay. Third ventricle. And fourth ventricle. No? Okay.
Yeah.
From here to here,
Foramen osmorum.
morum. No sé cómo se escribe.
Sabes.
And from third to fourth,
Sa.
aqueducto ocilium.
Maybe.
Got it? And from here, arachnoid. That
Mm-hmm.
that's the part. Okay. The fetal ventricles are important, that's part of the protocol, right? Because ventriculomegaly or hydrocephalus is a sign of central nervous system abnormalities. Stenosis of the aqueductus sylvius is the most common type of fetal hydrocephaly. So, remember, aqueductus sylvius is the one that connects third with fourth.
Mm-hmm.
So, if you have stenosis of the aqueductus sylvius, you will have dilation of the second and of the third, and the two lateral. The fourth would be normal. Got it?
Mm-hmm.
Because the obstruction is between 3 and 4. So if the obstruction is between 3 and 4, the 4 is normal, it's not dilated.
Mm-hmm.
And the one that is dilated is the two lateral
Draw
and the third.
one.
Got it?
Yeah.
Devonian, got it? Okay. Well, dilation of the entire system, including the fourth, is associated with spinal defects. So because
Spinal
you are-
defect.
the obstruction or the problem is more down. So in that case, the fluid cannot goes down through the whole spine, and then you have 4, 3, and the two laterals, like this.
Mm.
Okay? The lateral border of the ventricular chambers are represented as two echogenic lines, parallel to the inter-hemisphere fissure. So you have the middle, and then you have two little lines on the side, which is the roof and the floor of the two lateral ventricles. Okay? Normal ventricle, keep that in your head, 10 millimeters. Have to be less than 10 millimeters. Okay? The lateral ventricle. Could be 8, could be 6, could be, pero no more than 10. Okay, míralo aquí. That's a factor entry, and that is one parallel line, and the other one, and that is the lateral ventricle. And this is the core plexus inside. Got it?
Mm-hmm.
Okay. The one on the top, they have to do another image because it's not clear there. That's all. Avicii? Okay. Have another one? And say, oh, here again. Okay, that's the five. That one is one of them, and this is the other one. Got it? Super clear, that image. Beautiful. And look the head. Oh, niño, mira para atrás. The head is oval. Okay? It's not round, it's oval. Okay. The falciform or interhemispheric fissure, okay, is a dense band of fibrous tissue that cover one hemisphere, cover the other hemisphere, and what you see in the middle is that fissure, no? It's like a depression, okay? A missing mid-five or partially or totally indicate that the cerebral hemisphere are completely connected or less connected than expected, and that is a big variation. Okay, have to be separate.
Is that what's holoprosencephaly?
That's holoprosencephaly. Well,
Well, all the encephalies, because it could be 4
the
minutes.
interhemispheric fissure of five cerebri is observed as a membrane that separates the two hemispheres equally. It's an important landmark to visualize because its presence implies that the separation of the cerebrum occurs and everything is fine. This excludes severe anomaly, holoprosencephaly, in which there is only a single ventricle without any separation in between. Guys, the connection between the two hemispheres occurs due a bunch of white matter, which is the
Pia matter?
The corpus callosum. The corpus callosum is a structure which is full of nervous structures and white matter that connect your coordination between your two hemispheres, cerebral hemispheres. I don't know, you know that the left side is the one that
Controls
the movement,
movement.
of the right and vice versa.
Mm-hmm.
Empezaron los movimientos.
Punta falla.
Okay, that is the fast libre, okay, and the two ranges. Okay.
Mira, la insinuation del sonido ese.
Okay, what about the thalamus? The thalamus is a small structure within the brain, located just above the brain stem between the cerebral cortex and the midbrain, and has a staphyl nerve connection to both. That's another structure that connects both hemispheres. The main function of the thalamus is to relay motor and sensory signals to the cerebral cortex. It also regulates sleep, alertness, and wakefulness. So, super important. The thalamus is around the third ventricle. Okay. So remember you have the thalamus, the structure that looks like a heart,
Mm-hmm.
in the middle, and a little thin in the middle that we all sometimes never notice. That is the location of the third ventricle. It is a subdivision of part of the brain called the diencephalon, and is one of the largest structures derived from the diencephalon during embryonic development. The thalamus should be located symmetrical, so has to be same shape in one side, same shape and size in the other side. Okay, that's the thalamus. That is a view that is not the one that we see of course.
Mm-hmm.
But for you to get an idea, that is the corpus callosum, and that is the thalamus.
The brain is so weird.
So, same structure, if you see the head from the other side, have to be in the same, at the same level and the same location. Okay. Más o menos, that's the thalamus, right here, okay? That is the lateral ventricle, and that is the thalamus, and that is the third ventricle. Got it?
The third
The third.
and the fourth, abajo.
And fourth. Okay, that's the thalamus. You see, as I told you, the third ventricle is sometimes not visible. You don't see it, but it's right there. Deeper, a little more deep. Okay, in the middle between the two thalamus. Capisci?
Mm-hmm.
Okay. Tiene un septum pelúcido, no se ve muy bien, aquí right here. En esta no se ve. I don't see it. Okay. Kevin septum pellucidum is a marker for fetal neural mass development. I remember in Jackson, part of the protocol, day 1. A picture only of the cavus septum pellucidum. So you have to find, even if you get that picture, you need one when you show the two little lines, that is the cavus septum pellucidum. And that's the reason. Because it's a marker for fetal neural mass development. The septum pellucidum is a thin triangular vertical membrane separating the anterior horn of the left and right ventricle. During fetal development, approximately the 12th week of gestation, space forms between the two lamina. That's why you see one little echogenic line here, another one in the middle, and anechoid in the middle, in between the two of them. Vaya, esa imagen está espantosa. Espantosa. Pobre niño, se le dieron una pedra ahí. Está cabrona. Okay. The cerebellum. So at this moment you have to do like this, and angulate more down, the cerebellum is right here.
Mhm.
Mirror again. Do
Mhm.
the cerebellum. So you are standing here, and then you have to do whoop, and goes more down in order to see the cerebellum, which is super important. That is the cerebellum right here. Or that is the whole cerebellum. I don't know. Maybe it's a picture of the whole cerebellum.
It's a lot of functions.
Okay. It's a region of the brain that plays an important role in the integration of sensory perception and motor control. Okay? The cerebellum is located in the inferior posterior portion of the head, inferior to the occipital lobe, which is this. You see the two occipital bones? Oh, yeah.
Yeah, it has a lot of functions.
Okay. Has several roles related to movement and coordination. That's why the people say the cerebellum is affected by the alcohol. That's why the people lose the balance
Mhm.
when they are drunk. Coordination movement. Most body movement require the coordination of multiple muscle groups. The cerebellum time muscle action so that the body can move smoothly is the one that coordinates. You know, you can have those impairment when you walk that you notice in people that have a stroke,
Mhm.
that they have coordination in the movement. Maintain balance, okay, has special sensors that detect shifts in balance and movement, then send signals to the body to adjust and move. Vision, responsible for coordinating eye movement. Motor learning, okay, help the body to learn, so when you learn to ride, or, well, in those days, the people learn to ride, so nobody ride anymore, but that is the cerebellum. Another function, researchers believe the cerebellum has some role in thinking, including thought related to language and mood. These functions are not yet well understood. The brain is a mystery, definitely. Ya voy a hablar. Okay. Here it is. That's a beautiful. Okay? And be careful. When you do that angle and you see the cerebellum, this is not the thalamus. Even that looks similar, that is the cerebral pedunculus. Okay, los pedúnculos cerebrales. Okay, so in this beautiful picture you have the cerebellum that looks like a number 8. Okay.
Or a barbell.
This is the cisterna magna, which is part of the fourth ventricle, right here. And this is the nuchal fold. The nuchal fold
The
is
neck.
a fold that occurs in the
Neck.
in that area of the neck that has to be a specific measure, okay? Pulsation from the basilar artery is observed between the lobe of the peduncle, right here, you can see. You know what is the basilar artery?
Yeah.
What is
It's a
the
branch
basilar?
of the vertebral artery.
Okay.
Omar taught us
The
that.
two vertebral arteries
Oye.
join and become the
Y yo me acuerdo, oye, vascular.
Vamos.
Bueno,
Coño. Okay.
Igualita de Camila.
Oye, no me compare.
Cerebellum, peduncle. Okay. That's another view of the cerebellum right here. Cerebellum magna or nothing. Okay, the cerebellum is a dumbbell shape, más o menos. Two lateral lobes with a central connection which is called
Vermis.
the vermis. Cerebellar, cerebellar. About the measurement of the cerebellum measure is one of the things that you can check the gestational age when you measure the cerebellum in a normal patient, of course. If you have 17 weeks, the cerebellum measurement is 1.7. If you have 20 weeks, the
2.0.
cerebellum has to measure 2 centimeters. If you have 25 weeks, 2.5 until the week 26. After that, the cerebellum maintains the same dimension, around 26 millimeters. Okay? And that is the cable septum pellucidum right here. Aquí se ve bien. The cerebral pedunculus and the cerebellum. Again. TCD means transcerebral cerebral distance. CHC. Cerebellum. Whatever. It is important to recognize the usual configuration of the cerebellum because when you have open spina bifida, which is very serious deformity in the spine, the cerebellum is like has been suctioned by the spine, and instead of look like an A, look like a moon.
Mm-hmm.
Because the spine is open.
It would drain close.
It's like the cerebellum goes in and change the shape and become like a moon.
Mm-hmm.
That's why it's called banana sign. Okay? Measurement 26, up to 26. Okay? The cisterna magna, which is posterior to the cerebellum, is filled with spinal fluid, okay? And the normal cisterna magna has to be between 5 to 6 to measure life more easy, less than 10 as well. Because it's between 3 to 11, less than 10. Okay, and it's the same measurement that you have for the lateral ventricle, less than 10. Okay, para que no tengan que aprenderse tantos números porque se vuelve loco. The normal appearance of the cisterna magna is two locals all open space. Mira aquí, that's the cisterna magna. Cerebellum and cisterna magna. Cerebellum, cisterna magna, and the last one is the nucleus. The nucleus is the band of the skin, okay, in the back of the neck. Measure from, okay, the nuclear fold is measured below, before 20 weeks of gestation, right? Between 10 to 13. After that time, the measurement of the cisterna magna don't have too much value. Don't have to be measured at the beginning. The depth of the skin of the occiput is associated with chromosomal defects, particularly trisomy 21, and other conditions including genetic singles. Thickening in this area identified in the second or third trimester fetus is called increased nuchal fold or increased nuchal skin fold thickness. So it's less alarmante. Okay? Now that at the beginning. Okay, at the beginning.
It's less likely than in the beginning.
What?
No, it's not less likely.
What was the word you said?
It's less dangerous if you found this increasement
Increasement?
at the after 20 than if you found it at the beginning. At the beginning,
Oh, okay.
between 12 weeks, something like that, is associated with malformation. Eso es difícil de medir.
So it's that right
Okay?
there.
All reliable after 20 weeks of gestation. Okay? That's the cisterna magna. Okay, in this image you have the cerebellum, cisterna magna, nucleus fold, the facts, and the cable septum pellucidum. Capisci?
Mm-hmm.
Mira mi belleza. Okay, again, false. Sorry. Cable septum pellucidum, false. Cerebral peduncle, cerebellum, cisterna magna,
Nuchal fold.
and nuchal fold. Okay? Thank you for taking me. Beautiful, 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 beautiful. The orbits.
Yikes.
The orbits have to be symmetric. And in some machines, I have one that has that choice. That one don't have this choice. But most of the time, when you work in OP only, they have that
Measurement separation.
no.
Chinese guy.
Shut up! Let me think. The measurement from the towards outer border of the orbit can help you to determine the gestational age as well. Okay? So the third step is to scan inferiorly or below the cerebral plane, and the orbit may be visualized. So if you are like this, what you have to do? Like this, to see the two orbits. It is important to know that both fetal orbits are present, and you see the little circle inside, which is no, what? The eyes. Okay, ahora te lo digo, ahora te me sale. O maybe anda por ahí. No, this. Okay. Measurement of orbital width has been reported to aid in the gestational age, as I told you, and detecting abnormalities of spacing between orbits. There are conditions in which eyes may be missing, which is called anostalgia, fuse, or very close, which is hypotelorism, or abnormally widened, which is hypertelorism. So you have three conditions here: anostalgia, hypotelorism, or hypertelorism. Okay, that is the. ¿Cómo se dice, Omar? Dime otro nombre. Occipito. No.
No.
Outer
to outer diameter.
Outer orbit diameter,
Sí.
inner orbit diameter,
yeah.
and then the individual
Okay.
orbit measurement, like this. OOD, yeah.
Yep.
Outer, so you have this measurement first, outer orbit diameter,
Después,
then you
inner.
have inner orbit diameter, and then you measure
Each individual.
orbit individually.
Okay.
Like this. In this case, this patient has hypotelorism, too close, both orbits. Okay, there. That is a hypertelorism. Okay, when you mix
Watch the
those
next slide.
things, okay, that the orbit would be too widened, or when you measure the both orbit would be out of range according to the gestational age. That is hypotelorism, hypertelorism, hyper, and hyper. Estoy dando un machetazo a pobre. En medio de la cara. Mi amor, because that is the life. If you don't want to see this, go to business administration, because this is not.
Ese el que hablamos los otros días, el Olonfo, ¿cómo se llama?
Yeah, has
Cyclops.
only one eye. Yeah, you can be sure that these
They
babies,
knew when.
They don't last long.
the cerebral deformity are a lot. O sea, it's not that thing.
Chromosome abnormality.
Remember what I told you, when you found one abnormality,
There's
you
always
look
another
for the
one.
other one, because
There's always another one.
this never comes
Miss
along.
Ann, when she was pregnant, she knew this.
Eh?
They knew that. When she was pregnant, before she had the baby, she knew.
I don't know, mi amor.
I
don't
mean,
know
we're
the
guessing,
baby.
yeah.
Maybe that is in the middle of Africa or in the India.
Yeah.
Or they don't do, and they discover everything at the
Después,
end.
yeah.
Probably like India or something.
Ariel.
I'm just saying.
It is true, pero coño.
Yeah, it's true.
It's true, pero
It's no como racismo ni nada, pero.
no, I know, pero
Yeah.
It's just because of their way of life.
I know.
Yeah.
Not only that,
And the religion and all that thing.
Mhm.
Like,
Okay.
they don't have the means for anything.
Vamos a seguir.
And then you see a baby with one eye,
The face. The face is the other view that you can see
The cleft.
clearly the lips and any cleft lip or lip cleft, whatever, I don't know how to say it.
Cleft
I
lip?
don't know. And the profile, show.
Que me asustaste.
The profile is an important one because, guys, with the profile, you can see the chin, which is important because some patient has something that is called micrognathia. That is like this. Okay, that is sometimes associated with problems. This is super important.
The bridge, yeah.
The nasal bone, which is absent in trisomy 21, and the contour of the frontal bone. All this is important. It's not only for get a picture and give to all the family members. Okay, that's a beautiful one too. Okay, that is important.
No cleft lip.
A mouth and nostrils.
That's very clear.
Very clear, beautiful. Mm-hmm.
Oh, wow.
Yeah.
The lips are very clear.
Oh, that's sí tiene cleft.
Mm-hmm.
Upside down.
That one, right here.
It opens.
Un poquito.
Okay.
Missy, eso es genetic.
No.
The
Could be
cleft,
associated, but sometimes it's a defect, an accident, because the tissue. Of,
Yeah, it doesn't
okay,
close.
the tissue, this tissue, that's why we have these two. Everybody has this line. This tissue coming from the tissue that coming from here, nose and goes down, and this coming from here. I have to close. So sometimes don't close, and then you have the
Scar.
like a phoenix. Okay. Spine gears has to be like this from cervical, thoracic, and lumbar. I know this is lumbar because that is the bladder and that is the head. Okay?
Railroad
Yes.
sign.
Okay, me alegro mucho. Both plane, sagittal or corona and transfer. That's the way it looks in sagittal and that's the way it looks in transfer. You have to see the ossification centers, you have to see these things, okay, on the side. You have to see that the whole vertebra is closed to allow the spina bifida. Railway sign, very close, very nice. Okay, and in transverse plane, have to be like this, okay? Redondita, cerradita, That is thoracic because we are seeing the stomach on the tongue and the liver, so it has to be right here, more or less. Okay, it's important to know the integrity of the skin because this membrane is absent in fetus with open spina bifida. Ese está perfecto. Beautiful. Beautiful. Okay, okay. In the thorax, the most important view is the fourth chamber because you see the fourth chamber. You can see where the apex is, the inclination of the apex. You can see the two lungs and you can see the descending aorta. And you can see the thoracic spine. So it's a very important view. Okay, you know that the fetus is unable to breathe air in uterus. The lungs are important landmarks to visualize within the thoracic cavity. The lungs are very similar to the liver in texture, and they are a little more hyper than the liver, but they are very similar. Fetal breathing movement also are observed at this level. Remember, guys, the baby breathes fluid, amniotic fluid, which has a substance that is super important in the lung maturation. That's why the main concern when the baby has low amniotic fluid or rupture membrane is that the baby are not incorporating, breathing. Incorporating amniotic fluid to the lungs, so the lungs become hypoplastic, and the baby died because of that. Fetal lung tissue appear denser than the liver as the pregnancy progresses. The ribs, scapula, and clavicles are bony landmarks for the chest cavity. Okay, that is the heart, the stomach, lungs, and the diaphragm, that in this case looks hypoechoic, different of an adult that looks hyperechoic, because the impedance of the lungs and the liver are very similar, okay, and then no reflection occurs. Remember, more different impedance, more reflection, less transmission. In adult, because the lungs are full of air, the air and the soft tissue has a huge different impedance. That's why the diaphragm in adult looks hyperechoic, because the reflection is huge.
So the older they get, the more hyperechoic it looks.
Huh?
So the older the child gets, the more hyperechoic it gets?
A fetus?
No, once they're
No.
born, the
Once
older
they
they
breathe.
get, it
No.
gets more hyper?
No. Immediately the baby
With
born,
born?
the diaphragm looks
Hyper.
like me.
This one.
Hyper.
Because you have air in
Air.
one side and soft tissue in the other one. And the difference in impedance between air and soft tissue is huge, and then a lot of reflection occurs, and that's the reason because the diaphragm is the only muscle that looks hyperechoic, because the muscle, I know you know, the muscle looks mid-grade, okay. Me alegro mucho. Ahora canta la mierda ya. Okay, that is the heart with the, bueno, ahora vamos a ver el heart. Okay, that is the lungs, beautiful. Okay, has to be like this, very homogeneous, because if you see something inside, it's a pathological condition. Okay, guys, I know you know because you are getting sorry, echo. This is the descending aorta, which is close to the left atrium. Okay, so this is the right side and this is the left side. The other thing is, vamos a pasar aquí. Okay. As I told you, most major anomalies of the heart are excluded when cardiac anatomy appears normal in the fourth chamber. When you see a nice fourth chamber, you are almost sure that the heart don't have any problem. The apex of the heart should point to the left, which is called levo, which means in Latin left, levocardia. Right means dextrocardia. Levo, which is to the left, is levocardia. The ventricle usually has to have the same side. Atrium has to have the same side. Of course, the interventricular septum has to be intact, because you know, in between atriums, you have then the foramen valve, okay, which is that is a communication between the two atriums that occurs in fetal life, and immediately when the baby cries and the respiration occurs, the pressure's different. The foramen valve has a slab of tissue that close the foramen valve. ¿Qué más? Mira qué lindo. Okay. Interventricular septum totally closed. Interatrial septum with the foramen valve, mitral valve, because this is the left and this is the right. No sé por qué, ellos saben que es el right, no veo nada que me lo diga hasta ahora en esta imagen. Ok, aquí sí.
Ahí.
Aquí sí. Ok, vamos a ver esta foto. If you divide, okay, that's the spine, correct?
Mm-hmm.
That's the center. If you go through here, remember this is on the left side. The descending aorta go to the left.
Left.
If you go this and this, perpendicular, okay, the apex has to point definitely to the left, okay? Around 45 degrees is the position of the heart. So, if I have the descending aorta here, that means that this is the left side. Which other landmark? These things right here, which is called moderator band, or banda moderadora in español, moderator band that is located only in the right side. That is the beautiful uninterrupted septum, intraventricular septum, and that is the foramen ovale. Capichi?
Mm-hmm.
Me alegrichi muchísimo. Esto es como un short view, un short axis, me parece, aunque aquí no se ven bien nada. That is the aortic arc, okay. Okay, all these should be observed in the four-chamber view. The two ventricle and ventricular walls should be equal in size. Two atrium walls equal in size. The apex of the heart pointing to the left. The moderator band on the right ventricle. The foramen ovale between the two atriums. At least one of the pulmonary veins should be seen entering the left atrium. The motion of the atrioventricular valve should be regular, of course. Ventricular septum complete. Two ventricles lie near the chest wall and the two atrium near the spine. And the left ventricle is ipsilateral with the stomach in the normal fetus. ¿Estamos? Me duele la garganta. ¿Qué hora es? Las 7.
7 casi.
Nada más.
Nama. The diaphragm, you know, I think we can move
Yeah, you
forward
can do that.
because the diaphragm, you know, is the one that divides thorax from abdomen, and that is the image that you have to get and document. Beautiful, right here. Okay, that's the thorax, that's the bladder, that's the stomach, that's the gallbladder, that is the heart, and the two lungs. Down?
Mm-hmm.
Okay. Mira qué lindo eso. Qué bello. Beautiful, beautiful, beautiful. I'll go and bring. Yes, drink.